In a historic move, today the FDA announced it will officially end the lifetime ban on blood donations from gay and bisexual men. And as Bobeth Yates tells us, Atlanta was actually the center of a study to make all of this happen, Bobeth.
That's exactly right. I'm told that Atlanta had more people participate in that study than any other city in the Southeast. And those we spoke to say this decision ends years of discrimination, primarily against gay men.
I'm not personally a fond of needles and giving blood, but I will now do so knowing now that I don't have to lie.
Ron Roberts is among those celebrating the FDA's decision to lift a ban on gay and bisexual men blood donations.
A certain amount of vindication. For a long time, we've been denied the opportunity to give blood, or would have to, lie when we decided it was important to give blood.
According to Dr. Lubrick Frontier, who researched blood donations within the gay men community, the decision to relax the restrictions come at a time when there is a dire need.
It's time. One side of me feels sad because it's happening because we need it. Blood availability in the United States is an emergency, it's a health crisis.
And Frontier says the science behind the FDA's ban was based on flawed information.
The science changes. We cannot have a science from 1972 and apply it today because the tools we have as scientists evolved. So I will not blame something that happened or decisions that were made 30 years ago. What I will blame is that we are still counting on them.
According to Stephen Igorowski, the director of engagement of the Atlanta Pride Committee, Atlanta is one of the cities studied by the FDA as they considered reversing the ban.
I've been advocating for this for decades because it's really based in outdated information and misinformation.
And Igorowski says relaxing the FDA's lifetime ban on blood donations from gay men ends years of discrimination based on sexuality.
Instead, it will be based on a screening process, based on risk activities that will be applied across the board equally to everyone. And that's all we've been asking for.
Now, this isn't a done deal just yet. The proposal will be open for a 60-day public comment. Then the FDA will review those comments before finalizing their guidance. In Atlanta, Bobeth Yates, 11 Alive News.
Thanks, Bobeth. And our Atticus team has done a full investigation into the biases against some blood donations. To see that full series, head over to 11alive.com and search blood bias.